Choosing a Medicare health insurance plan is complicated. Using an agent can help you make sense of the Medicare process. Change your Medicare experience with Madigan Insurance Group. Our licensed staff members provide education to help you understand all of your Medicare choices and make sure that the plan you select is specific to your personal health and financial needs. When it is time to enroll, you can be certain that you have the most accurate information to make an educated enrollment choice. We can secure your same benefits for a lower price by shopping the market for you. To better meet your needs, local agents provide personal service. We can answer all of your Medicare questions. From Medicare, individual health, and other health products, we are here to help. Stop wasting time on guesswork. Come to one of our free Medicare Made Clear seminars to learn how to maximize your benefits and how to avoid penalties that last your lifetime. To get started, call Vicki Madigan for a no-cost needs assessment. Call 847-457-1802 or visit madiganins.com.
Oh, yeah.
Good afternoon, everyone. Thank you for coming to the Elderwerks Aging Better Expo, and I have the pleasure of introducing Vicki Madigan. I did say it the right way. She is the agent and broker owner of Madigan Insurance Group. Prior to opening her insurance agency in 2011, she spent most of her career in public education and corporate training. As an agent broker, she draws heavily upon her vast background and experience in teaching to present complex insurance issues in a style that makes it easy for everyone to understand, educating consumers as much as in a strong position to help them understand a structured healthcare coverage that meets a specific need. That's a lot, right? But here's what I am to tell you. We at Elderwerks very much appreciate Vicki and her support of what Elderwerks does. Vicki can take something that is very complex and make it very simple without making someone feel like they've been talked down to, and it is greatly appreciated. You're in for a 45-minute presentation, and then she's going to do questions and answers at the end. I will turn it over to Vicki.
Okay, well,
Vicki, thank you so much.
All right, so she told you I was a teacher, right? So you got a folder. No, you don't have homework, okay? So you have this folder. And in the folder, you've got a blank piece of paper. So if you want to take notes, you can take notes. Most of the graphics on the left side are copies of graphics in the PowerPoint. And then we have my business card on the right. If you're somebody here getting ready to turn 65, you have a turning 65 checklist. And this is our flyer for Medicare open enrollment, which is always October 15th to December 7th. And the very last thing is a customer care. I'm going to go over that, like how to talk to a customer support, because I'll just start with that. So whatever insurance you have or calling your doctor's office, if you look at that customer support handout in the right pocket, it will tell you, it'll say date, time. Have you ever gotten on the phone and you had to wait so long you forgot what your question was? So if you fill out what your question is, or what you're trying to get resolved, or whatever resource you're trying to get, if you fill that out first, if you end up on hold for a while, you're not going to forget. The importance of recording the start and end time of your phone conversation is whether it's a healthcare provider or an insurance agency, they always record your call. So if you call XYZ insurance company and they tell you your copay is $50 for a certain procedure, and then 12 weeks later you get a bill for $1,200, you're not going to be happy. But if you've got this all documented and you get a reference number or a confirmation number at the end of your call, then an agent in my agency or myself can help you get that resolved. And with me today from Madigan Insurance Group is my agent, Andrea Carroll. So let me tell you now a little bit about Madigan Insurance Group. We have a brick and mortar office in Huntley, right outside the Del Webb community, where you can come meet with us in person. I've gotten up to speed technologically. We can do a Zoom call now, or we can do a virtual call. Sometimes we just do a telephone call. So we have clients as far away as Arizona and Georgia and Florida who definitely don't come for an in-person appointment, and we're still able to help them. Okay, oh, I guess I got this here, hang on. I didn't point it the right way.
There.
Okay, so this disclaimer, how many of you people watch TV? How many people have seen Joe Namath? Okay, don't call Joe, call me. But because of Joe, we now have to put this disclaimer so that we are compliant with CMS. So CMS is Center for Medicare and Medicaid Services. We must and do follow all the rules of CMS, okay? We are agent brokers, so we do offer most plans in Cook, Kane, Will, McHenry, Grundy, the greater Chicagoland area. We're very well versed in those. I'm not good at this.
What button are you pressing?
The top one.
Look at the little arrows. Should be one of those.
Oh, they didn't tell me that. Okay, here's our agenda. Thank you for that help. Today our agenda is what is Medicare, who is eligible for Medicare. Oopsie, now it's going
That's
on its
me.
own.
Sorry.
Okay,
I'll
I need
fix
the
it.
agenda slide. Oh, you're going the wrong way.
Oh, am I?
Yeah, go back.
No, this is not working the way it should.
Oh,
Oh, too far.
there you go. Do you want me to let you do it?
No, you do it. You
And
got it.
this arrow?
Yep.
Okay, so enrollment periods are really important when you enroll, next steps, and where can you find more information. Okay, you need to be a U.S. citizen, older or younger than 65. If you're under 65, there are certain qualifying conditions that allow you to enroll in Medicare Part A and B. If it's a disability, it comes in month 24. So usually when you apply for Social Security disability income, you've got a waiting period. It's, there's a hearing and all of that. They will go retroactively, and even if it's a year, let's say you started in January of 2022, they'll go back to January of 2021. They'll count that whole year, even though they you weren't technically on disability. Then they'll count all of 2022, and then the first month of 2023, which is month 25, you will have a Medicare ID card. You won't even have to apply for it. This is for people under 65 collecting disability, and you will be Medicare eligible.
Now they're gone.
Nope.
Okay, these are the parts of Medicare. What I want you to look at here is the word part. So a little bit of history. Medicare started in 1965 with the Social Security Act. It was Lyndon Johnson's presidency, and he just decided to assign an alphabetical letter to all of Medicare parts and pieces, okay? So the two words you'll see in Medicare are part, and then you'll see the word plan. Part A, Part B, Plan A, Plan B. They're as different as your hand and foot, okay? So you can't just say they're the same thing. You really need to keep abreast of the word part and plan. Okay, you have this chart in your folder if you want to look at it or take notes on it. All right, sorry, am I still in your camera? Okay, so step one, most people don't realize Medicare begins at the Social Security office. So the very first step, if you aren't that person with disability, is you need to apply for that original red, white, and blue Part A and B card. And you start with applying for that at the Social Security office. Now, 3 months before your 65th birthday is a good time to start applying for that. If you applied for only Part A, because you were still working and on an employer plan, before you can get a Medicare supplement or a Medicare Advantage plan once you're retiring, you need to get Medicare Part B, as in boy. And that takes about 3 months. So I have a lot of people who will retire at the end of December, and they'll come see me like December 28th. I'm retiring in 4 days, so I need Medicare. I'm like, you need your employer to fill out a form, you need to fill out a form, so it's gonna take some time. All right, it just jumped ahead. Can you make this, I'm just gonna let you do this, I'm gonna tell you when to change the slide.
Okay.
All right, so I need it back on that chart, please. Okay, sorry, there. Okay, so you're gonna apply to SSA.gov, and then they're gonna send you some letters after you apply, and then you're gonna get a Medicare ID card. And once you get that Medicare ID card with Medicare Part A and B on it, then you can go ahead and call our office, and Andrea or I or Ed will meet with you, and we'll help you select a Medicare supplement, drug plan, and or a Medicare Advantage plan. So the next part of the step 3 is you choose a path. You go down the left side or you go down the right side. Think about when you're driving in a car, you cannot drive on 2 roads at one time, right? So you cannot be enrolled in a Medicare Advantage plan and a Medicare standalone drug plan with a Medicare supplement. It's either or. Now the good news is, if you don't like whatever you enroll in, come the annual enrollment period, you can make a change. So whatever you're in on January 1, you're probably in it the remainder of that calendar year, unless you do something like move out of state or move to another county if you're in a Medicare Advantage plan. All right, let's go to the next slide. Okay, let's go over some definitions. So the definitions of different parts of insurance, people get really confused. And the definitions are premium. So you're going to pay a premium to Medicare Part B. The premium this year is $164.90. Everybody pays Medicare Part B premium unless you are Medicaid eligible. Then you're going to pay a deductible for your coverage, which means that you pay until you meet whatever that deductible is. The ones that most people get very confused about are copay and coinsurance. So a simple way to remember the difference between copay is always a dollar symbol. It's a flat dollar amount, like $20. Coinsurance is always a percentage, like 20%, okay? All right, let's talk about the Part B premium. On your original Medicare card, you have Part A hospital, Part B medical. So the premium, as I said, is $164.90. How do you pay that? If you're like me, I'm not yet receiving my Social Security benefits, so I make a payment to Medicare for my Medicare Part B premium. When I eventually take my Social Security benefits, then they will deduct the Part B premium from my check before they ever send me my money. So I put the 2023 premium amount of $164.90. Now that $164.90 is a standard amount. It's the standard amount. So there's a table at the Social Security website that has different levels of income. They group it in filing single or filed married jointly. And then they put dollar amounts on them, and it's a table. So for this year, for 2023, if you're single and your modified adjusted gross income is less than $91,000, you will pay the $164.90. However, if you're single and your modified adjusted gross income is over $91,000, then you will pay what's called an IRMA penalty. It stands for Income Related Monthly Allowable Adjustment. That IRMA penalty is applied to both your Medicare Part B premium and your Medicare Part D premium. If you file married jointly, it's $191,000. So if you make less than $191,000 married jointly and modified adjusted gross income, you pay the standard rate of $164.90. All right, let's stop on this slide. You notice Part A, hospital insurance. These 5 things are covered under Part A of original Medicare. Inpatient hospital care, inpatient psychiatric behavioral health care, inpatient skilled nursing services or rehab services, hospice care in a facility, hospital, or your home, and some blood transfusions. Now, told you I used to be a teacher, so let's do a word analogy here. Look at the circle, you have a bed, you're sick, you're not going anywhere, and A is Part A of Medicare, but it also stands for A equals admitted. They admitted you to the hospital, okay? So I'll get some folks, older folks, that come to me and say, well, that ambulance took me to the hospital. I went into the emergency room and then I stayed in the hospital. So why is my emergency room under Part B? You can go to the next slide. Part B for medical. Because the emergency room and the ambulance ride are under Medicare Part B as in boy. Okay? And then the Part B status is outpatient. And have any of you ever been in an emergency room where they said, well, we think we're just going to watch you, or we're just going to keep you here tonight? Do you know what that's code for? Observation. Yes. And in Medicare, observation is not your friend.
Right.
Because there's lots of loopholes in observation. Okay? So it's not that it's bad. It's not that it's not going to be covered. But you have to be very careful about moving from observation to a skilled nursing facility or a rehab without being admitted. And that's a very long conversation. And I tell people if they can't sleep, go Google that and watch that on YouTube and you'll learn a whole lot, okay? So Medicare and observation. Okay, these other parts of Medicare Part B, which is outpatient. B, bye, you go home, you go to the doctor's office, you go to the outpatient hospital to get an x-ray, you go to a lab, you do any of those things, that's under Medicare Part B. So to real quick recap, we have on your original Medicare, Part A hospital, Part B medical. All right, let's go. Doesn't like you either, right? Here we go. Okay, now, if you only had an original Medicare card and no secondary coverage, this slide shows you that you are a huge financial risk. So every year there's deductibles and co-insurance to Medicare Part A and B. So this year the deductible is $1,600. I want you to very carefully read that slide. That is not an annual deductible. That deductible renews every 60 days. So that's almost $11,000 out of pocket if you get admitted to a hospital mathematically 7 times in a calendar year. So how did they get that number? It's math. Take a year, 365 days, divided by a 60-day benefit period. It's almost 7 times. It's a decimal of like 6.789. Okay, so if you only have original Medicare and mathematically you're in the hospital every time your deductible renews, you've got almost $11,000 out of pocket, plus you owe 20% of the remainder of the bill. There's no ceiling. You just keep going in debt further and further and further. And then on the Medicare Part B, you have one deductible of $226. That's not so bad. It's only one time a year. It's for outpatient services. And you have a 20% coinsurance. So we share this with you so that you understand the urgency of enrolling in either a Medicare supplement and a standalone drug plan or choosing a Medicare Advantage plan. The choice is yours. Let's go to the next slide. Okay, so there's the definition. The book I have up on the corner is called Medicare and You. You can get one at your Social Security office or you can download it online. All of this information is in there. And this is a definition from Medicare of what a benefit period consists of. All right, let's talk about Medicare supplements, also known as Medigap plans. It will pick up those deductibles, co-insurances, and other expenses that are sent to you as a consumer from the original Medicare card. All right, if you look at the third bullet point, remember at the beginning I said we're going to look at part and we're going to look at plan. So look at the third bullet point. These are plans, and they have alphabetical letters, plans A to N. Now, we used to have C, D, and F, and some of you in this room may still have C, D, or F. You would have had to enroll in Medicare before January 1 of 2020. A law in 2020 called the macro law did 2 things for Medicare consumers. It took your Social Security number off your ID card and gave you a very weird looking number that doesn't relate to you. And it also took away the ability to enroll in C, D, and F if you turned 65 or qualified for Medicare after January 1st of 2020. Okay, so if you don't live in Minnesota, Wisconsin, or Massachusetts, and you move to another state outside of Illinois, this is all going to apply. But come back to me if you're going to move to one of those states, and I'll tell you how it works there. Because I'm also licensed in many different states, and Wisconsin is one of them. Go ahead. All right, this chart is in about page 70 of that book. And what does this chart show you? It shows you Medicare supplement or Medigap plans. And the left side of the chart shows you the charges from Medicare. And if you go from left to right across the top, those are the Medicare supplement plan letters. Okay, is everybody with me on that? So you take, let's say you want Plan G, and you go from top to bottom, you see there's only one place that does not have a number in it. Do you see that? Right here in Plan G, this right here, the Part B deductible, is not covered by Plan G. So that means you would pay the $226 deductible if you were enrolled in a Plan G. As of today, Plan G is the most comprehensive coverage someone brand new to Medicare can have, okay? And basically, those deductibles and co-insurances other than the Part B deductible are covered. So let's say we have a consumer on Medicare Plan G and they go in the hospital, they have a heart attack. That client on Medicare Plan G will not have a hospital bill. But Medicare will pay their part, then the supplement will pick up what Medicare didn't cover. Now remember, your Medicare supplement or a Medicare Advantage plan cannot pay for services not approved by Medicare. So if you think of a hierarchy with Medicare CMS at the top, and then you have your insurance companies, an insurance plan cannot pay for something that Medicare does not approve. All right, so really ridiculous. You want fuller lips like Julia, okay? And you go for Botox injections. Not Medicare covered. Okay, you're gonna self-pay for that. You have your traditional things like hips and knees and other arthritic things or heart things. Those are all Medicare covered services. If you're in doubt, you should, like you go to your doctor says, I want you to have this procedure. Get the code and you can call 1-800-MEDICARE and you can ask them, is this a Medicare approved services? Now I've been doing this since 2011. And about a year and a half ago, something I thought was covered, I learned that Medicare does not cover it. So I will impart that wisdom to you. So I had a client who had a double mastectomy. She went through chemo, radiation, all kinds of rehab, reconstructive surgery, and we went to get her a wig. And we were like, why is the plan denying this? Medicare, big Medicare, does not cover wigs. So you would have to go to like the American Cancer Society or some other not-for-profit that would maybe have grant monies or something for that. But I learned that because I never knew that. I just assumed that that was covered. So you don't want to, my point in telling you that story is you don't want to assume. You want to check it out because you don't want to end up with a big bill. For some, especially like some newer procedure, you want to make sure that it's covered. Okay, next slide. All right, so how do you enroll in a Medicare supplement? What do you need? You always start, you got the key in the door is the original Medicare card, Medicare Part A and B. You have to have that. Then you have to be a resident of the state for which you are applying for a supplement. So think about people who live in Illinois. Some of us want to get out of here when it snows. So we have Florida, Georgia, Texas, Hawaii homes, right? Or we at least go rent something somewhere warm to get out of the snow. So I cannot write you a Florida plan unless you have a Florida residence. What deems your residence? What does your driver's license or your public ID say? If you own a house in both places, you're paying taxes in both places. So it's not taxes because you're paying taxes in both places. Is what does your legal ID say the state you are, okay? So we had a customer lives in Niles, lives in somewhere Florida for 6 months. found out that Medicare insurance was more expensive in Florida and wanted to buy an Illinois plan, wanted his residence in Florida because of the tax deals, or like pick one or the other. You can't be a resident of two states, okay? So now he's paying more for Medicare, even though he lives in Illinois because his legal residence is Florida. So we come across all kinds of unique things every day, don't we? Okay, okay, let's go to the next one. All right, so we just put together, our agency just put together a video to explain to you how does Medicare, how does Medicare Part D work? So regardless if you're in the left lane with a Medicare supplement and a standalone drug plan, or if you have a Medicare Advantage plan, this little video that we just put together is going to explain to you how Part D of Medicare works. And I don't know if you want to put your camera on that. Okay, I'm just going to move over here while he plays that, and then I'll be back.
Today, we are going to talk about Medicare Part D prescription drug plans. You will need to enroll in a Medicare Part D plan even if you don't take prescription drugs now. You should consider enrolling in Medicare Part D drug coverage when you are first eligible. If you decide not to enroll, you may be subject to a lifelong penalty. You need Medicare Part D for prescription drugs if you do not have a health plan that includes credible prescription drug coverage, like drug coverage from an employer or union, or you do not receive extra help, LIS, low income subsidy. You'll likely pay an LEP, late enrollment penalty, if you join a plan late. In order to get a Medicare Part D drug plan, you must have enrolled in Medicare Part A and B, and it must be active. You can enroll in a Medicare approved plan that offers drug coverage. Here are your choices: enrollment through a standalone Part D plan or through a Medicare Advantage prescription drug plan. Medicare prescription drug plans help the consumer with the costs of prescription drugs. They are offered by private insurance companies. Here are some important facts about Medicare Part D. Drug coverage varies from plan to plan. Catastrophic coverage protects you from very high drug costs. Medicare drug plans may change annually. Each plan has a list of drugs that are covered. That list is called a formulary. Make sure your drugs are in the plan's formulary before you enroll in a plan. The formulary's list of drugs can change each year. Coverage is not automatic, and penalties may apply if you enroll late. What is the formulary? A formulary is a list of drugs covered by an insurance plan, and it can change annually. Think of the formulary as a dictionary that is alphabetically ordered from A to Z. Only the formulary contains names of medications. Each medication will be assigned a tier. In the listing next to the medication, you'll have a capital T with a number ranging from 1 to 5. Tier 1 drugs are the lowest cost. Tier 5 drugs are the highest cost. Medicare Part D has a yearly coverage process. There are 4 stages to the yearly coverage process. The process is the same from year to year. Each year, beginning January 1st, the coverage process has a deductible that CMS allows private insurers to pass on to the consumer. This year, the deductible is $505. This is the deductible stage. If the plan has a deductible, all consumers must meet it before moving to the next stage in the process, which is called the initial coverage stage. In the initial coverage stage, Medicare sets aside a yearly dollar amount to offset the total retail cost of the medication. This is called true retail out-of-pocket costs. Each Part D plan has a formulary and tiers, which determine the consumer's copay. The initial coverage stage is where consumers are paying a copay when they pick their medications up from their pharmacy. In our example, Sam goes to the pharmacy. The true retail cost of his medicine is $1,000. In January, Sam paid the $505 deductible for 2023. Now in February, when he picks up his prescription, he will pay a $50 copay since he is in the initial coverage stage. How does this work? The retail cost of the medications is $1,000. The subsidy is $950, money set aside in the initial coverage stage, leaving him with a copay of $50. The subsidy is subtracted from the $4,660 each time he refills a prescription with a retail amount of $1,000. However, $1,000 goes into $4,660 almost 5 times. When Sam returns to the pharmacy in June, he has reached the end of his initial coverage stage, and his bank is at $0. He is out of subsidy. He moves to the next stage in the process. Now the pharmacist tells him that he has a $250 copay. Sam is not happy. Sam has moved to the next stage in the Part D process, called the coverage gap, which some of you know as the donut hole. In the donut hole, or the coverage gap, the consumer pays 25% of the retail costs of their medications. Now, what happens with the retail sum of $1,000? Sam pays $250 each month until his troop reaches $7,400. This will take 7.5 months. There are not 7.5 months left in this calendar year. Sam will remain in the coverage gap until the end of the calendar year on December 31st. Then, on January 1st of the next calendar year, he will start over with a brand new deductible. Now let's say Sam has more medications than the $1,000 per month. And let's say Sam hits the coverage gap a few months earlier than June. Once he meets the $7,400 troop in the coverage gap, he will move to the final stage of the Part D process, which is called catastrophic coverage stage. In the current catastrophic coverage stage, the consumer pays 5% of the retail cost of their medications, or $10.35 for a brand name drug, or $4.15 for a generic drug, which is greater. If Sam is in the catastrophic coverage stage on December 31st of this calendar year, then on January 1st, he starts the process over in the deductible stage. Medicare Part D drug plans follow this drug process regardless of being enrolled in a standalone Part D plan or a Medicare Advantage prescription drug plan. This process repeats annually, and only the dollar amounts change from year to year. Consumers ask, what causes me to reach the donut hole or coverage gap? Here's the answer. The troop of all your medications as you refill them monthly reduces the money available in the initial coverage stage. When the funds in the initial coverage stage are exhausted, the Medicare beneficiary moves to the coverage gap stage and so on. For each part of the Part D process, it is the troop costs of your medications you are currently prescribed that moves a Medicare beneficiary through each of the stages of the Part D process. To conclude, we urge everyone to enroll in a Medicare Part D plan when they are first eligible to avoid a late enrollment penalty. If you should incur a late enrollment penalty, it will stay with you for the remainder of your life and will be billed to you monthly in addition to your Medicare Part D premium. To receive additional help at no cost to you, please reach out to an agent at Madigan Insurance Group annually to receive your Medicare Part D plan. Call 847-457-1802. Thank you. We look forward to being of service to you. Madigan Insurance Group, Incorporated. Changing the insurance experience one client at a time.
Okay, so that's how D works. And we know that Part D is stressful, so we gave you a donut stress ball. Everyone should have had one on their seat when they came in. Little donuts, do not eat it. I had someone try to eat one. No, don't eat it. Okay, it's a stress ball. Did you get a stress ball?
Yes.
Okay. All right, so we're gonna go back to the PowerPoint and just flip through that really quick. So you get to Medicare Part C. There you go. Okay, so now we're gonna talk about Medicare Part C. If you have your chart with the 2 lanes on it, this is the right lane called Medicare Part C, which combines Medicare Part A and B, and C, which is Medicare Advantage plans. Okay, Medicare Advantage plans are also offered by private insurance carriers. They combine, you have one ID card with Medicare Part C, where if you enroll in a Medicare supplement and a standalone drug plan, you will have 3 ID cards. All right, so when I get people who are coming to me like they worked at XYZ company, they had group health insurance, it was a PPO, they had 1 ID card, this is what works most closely to that. So they're understanding that, like if you're a baby boomer like me, you're understanding what an HMO or a PPO is. And Medicare Advantages are not Medicare supplements. Medicare Advantage plans are managed care HMOs and PPOs. They often include extra benefits like vision, dental, hearing, gym memberships, meals if you've been in a hospital brought to your home, those kinds of things. Okay, next slide. So what do you need to do? Again, everybody needs to have Medicare Part A and B. Now, what does this mean? You must live in a plan's service area. So these are driven by your county, okay? So my office is in Huntley, which is Kane and McHenry County. So let's say I have somebody in one of those counties enroll in a Medicare Advantage plan. Then they decide the winter's too rough and now they're gonna move to Florida, but they want pretty much the same plan when we change their plan for Florida. We can almost identically get them in a very similar plan in another state, but we have to give them the special election period of move because now they've, let's say, moved out of Kane or McHenry County and they moved to Pinellas County, Florida. So the plan could look very similar, but it's a different contract. So we have to do that. Now, a couple pieces of advice. If that's you, if you're enrolled in a Medicare Advantage plan and you move out of the service area for your contract, do not call and cancel your plan before you move, because you may find yourself without coverage. Yes, we've had that happen. It is better for you to move, unpack your belongings, go to the DMV, change your residence, call us, and then let us re-enroll you for the next month. You have 63 days after you legally change your residence to change your plan, okay? So if you don't, this is what happens. You move, you notify the post office that you move, your insurance company sends you some kind of a flyer, it gets a return to sender for move, you get disenrolled, you go to use your services, now you don't have coverage. And it's probably been more than 63 days since you moved, so now you lost your opportunity for a special election period. So an agent is really your best friend. We can help you navigate all of this. Just let us know what your life plans are and what you need to do, okay? All right, now, as I said, it's the convenience of one single ID card. Plan premiums and terms can change from year to year. You must continue to pay your Part B premium. You have one ID card. Most carriers, will have plans that include prescription drug plans. Now let's talk about that for a second. Who might not need a prescription drug plan and only a Medicare Advantage plan? That would be somebody like a veteran who has full VA benefits and they're getting all their prescription drugs through the Veterans Administration. They might choose to have veterans benefits plus a Medicare Advantage only plan. And many of the carriers have very specialized plans that really honor veterans in their service, and they have extra benefits in those plans to help the veterans. So yes, if you're a veteran, you need Medicare Part A and B. Get your medications from the Veterans Administration, make sure it's creditable coverage, but then come talk to an agent about a Medicare Advantage only plan, which allows you to not have to go to the VA if you've got a cough or the flu or something like that. You can go locally and you can basically double dip. Veterans benefits do not coordinate with Medicare. You have two totally separate groups of benefits. So that would be somebody who would get a Medicare Advantage only. Let's see, coverage limited to a service area unless it's an emergency. That would be a rule for an HMO. Another rule for an HMO would be a referral to a specialist. However, PPOs allow you to go in and out of the network, and you don't need a referral on a PPO. And our company represents insurance carriers that have both HMOs and PPOs. Okay, go ahead. So there again are all the types of Medicare Advantage plans. Again, the most popular are HMOs and PPOs. Special needs plans would be if you had a chronic condition like diabetes, COPD, or you qualified to be dual eligible Medicare or Medicaid. So now we're going to talk about enrollment. You can go to the next slide. There are 3 enrollment periods. The annual enrollment period, which is, this never changes. Like Christmas Day is always the 25th of December. Annual enrollment for Medicare is always October 15th to December 7th. And we talk about this all year, every year for the last 12 years. And yet on December 8th, somebody calls me and says, is it too late? And that unfortunate answer is yes. Okay, that's your annual enrollment period. Your effective date for whatever plan you enroll in is January 1. The second one is the initial enrollment period. That's when you turn 65. That's 3 months before your 65th birthday, your 65th birthday, or 3 months later. And you get some special benefits because it is your first initial enrollment. You get some guarantee issue benefits into Medicare supplements. And the last one is called a special election or a special enrollment period. There's like 33 different Medicare special enrollment periods. Some common ones are the moving from one state or county to another. Another would be you're over 65 and you're losing your employer group health coverage. Or another could be you just got Medicaid or you just lost Medicaid. All right, those are the 3 enrollment periods, and the dates are very important because, for example, once the AEP passes December 8th and later, you have to wait a year. If you miss your initial enrollment period, unless you have a special election period, you have to wait till October, and then you don't get into a plan until January. And earlier today, I talked with a consumer in our booth who got Medicare A and B in 2020, and she didn't enroll in a supplement, and she didn't enroll in a Medicare Advantage plan, and she didn't enroll in a drug plan. So we were calculating that she will have 3.5 years of penalty, and the soonest she can be active in a drug plan would be January 1 of 2024. Now, whatever penalty is assessed to her by CMS is going to stay with her until she passes from this earth, or until she becomes Medicaid, or if she ever becomes Medicaid eligible, they will remove the penalty. So I like to tell people, even if you don't take an aspirin, you still need to get a Medicare Part D plan as soon as you're eligible, because those penalties really add up. They get astronomical, they get added to your premium. I unfortunately, back in the early years of my business, I had somebody paying over $100 a month for a drug plan because their penalty was $86. So don't mess with that. There are drug plans, I'll just say, that are under $10. There is a very easy way to stay compliant in a drug plan and not get stuck in the penalty. Okay, next slide. Okay, this is our we have a banner in front of our office. We were like, I can't find your office. I'm like, there's a banner in the parkway. It's 6 feet by 3 feet. Okay, you should see it. But if you're on our mailing list, or you've been a client of ours, you get this every year, probably the last week of September. The back side of this postcard tells you what you need to do to be compliant for annual enrollment period. That flyer without all the directions is also in your folder. If you put it on your refrigerator or something with a magnet, you can't miss the annual enrollment period. Next one.
Ooh, I pressed the wrong button.
Okay, here is the website. So if I have anybody in here that's getting ready to turn 65 and they need to apply online, the website is www.ssa.gov. You can also go to your local Social Security office. and you can apply there in person if you don't have a computer. Next. Okay, so every year we want to review your enrollment period. We have software and we take lots of classes and get certifications so that we can research the best options for you. Medicare is very individualized. It's not a cookie cutter type of thing. What works, even in a husband and wife, they can be on totally different plans from one another. Just ask us questions, which we'll have Q&A in a minute. We will give you answers. We have resources for, like Elderwerks is one of our resources. We have financial resources. We have accounting people, attorneys that we work with. Make sure you enroll at the right time and make sure you do a yearly review. Okay, so we're going to leave that slide up. I'm going to pull this stool up and I'm going to take your questions. And if you could just yell it out. Does anybody have a question? I did that good of a job? No questions? Yes, sir.
Been on Medicare for 7, 8 years now. I thought a couple of years ago there was some talk about doing away with the donut hole. It was going to go away like January of 2024, 2025.
So there is some talk from CMS about eliminating the donut hole in 2025. All of the rules and the final words on that are not, it's not in print yet. So it hasn't been finalized by CMS, but yes, you heard correctly. Actually, since the Affordable Care Act came out in 2014, we've been closing the donut hole a little bit every year. Back in 2014, a consumer paid 100% of the retail cost of their medication. This year, in 2023, and last year in 2022, you paid, as you saw in the video, 25% of the true out-of-pocket cost. So yes, you are correct that they are working towards closing the donut hole.
Okay, thank you.
Anybody else? Yes, ma'am.
I missed the very beginning, but I thought I heard you say that the Medicare B and D had that IRMA.
So if you are assigned an IRMA penalty because you make too much income, the penalty will be assigned to both Medicare Part B of Original Medicare, and there will be another assessment added to your Medicare Part D drug plan.
You know, 1 year you were higher, and then the rest of the years you're not.
So it goes back 2 years. So for example, we're in year 2023. If you had higher income in 2021, in 2023, you're going to have an IRMA penalty. Now, if in 2022 your income drops significantly, you should get a letter sometime in December telling you that the IRMA penalty is no longer applying for 2024.
So then, if you are on it 1 year and the next year your income drops dramatically, they will adjust it.
Right, but they're, so for right now, they're looking at what happened to every one of us in 2022. What was our income in 2022? And you're looking at the modified adjusted gross income for year 2022. So if in 2022 you had higher income, but 23 your income dropped, you still have a penalty in 2024. Because it's a 2-year look back.
And then in 2025, when you drop dramatically, will they adjust it?
At 2025, they're looking at your 23 income. So if your income reduced dramatically in 23, you'll have a new assignment, maybe no penalty or a lower penalty.
And if they don't do it and you did, who do you go to?
Social Security Administration. Okay, yes, I saw your hand again.
Yeah.
My train leaves the track all the time.
Yeah,
Amen to that.
there's another question too.
All right, when you think of it, you tell me.
All right.
I'll come back to you. Anybody else have a question?
Are we ever going to eliminate the donut hole?
They're working towards that for 2025.
My husband is on remission from cancer and takes monthly chemo. We burned through the initial period,
Probably by February or
Yeah.
March.
February. And so then it's ouch, ouch, ouch for a couple of months and then.
Until you get to your catastrophic coverage stage.
Right.
Yep.
But, yeah, although he developed cancer before he was eligible for Medicare, and our co-pays on very good insurance were running $13,000 to $20,000 a year.
Yeah. You remembered?
Yeah, I'm sorry.
That's okay.
For the Medigap plans.
Yes.
The A, B, C, D, and so forth. Every single company, every single insurance company offers all of those plans. And you should be able to pick A, B, C, D, E, or whatever from any one of them. And they all have to offer the same services. Why are they charging different rates?
It's called America.
Is it literally just as simple as that?
It is. Okay,
And
so,
why is it so hard to find out the premium?
great. So can I make a couple clarifications for you? All right, so for example, I'm a broker. I have over 40 Medicare supplement contracts. Some companies maybe only offer, let's say I have somebody that wants Medicare supplement plan A. I only have 1 or 2 companies that offer plan A. But those 2 companies have to offer the exact same benefits. So the most popular plan right now is letter G, like George. And I probably have 40 carriers that offer plan G, all right? Now, one thing that most consumers don't know is Medicare supplements are federally regulated. And we are American consumers, right? We watch commercials. We can sing all the jingles, okay? So we think if there's a jingle that their product must be better because we're going to pay more for that product. It doesn't work that way in Medicare supplements. So if you have 2 companies, take 2 Medicare supplement companies, and they both offer plan G, and this guy and I go get our appendix out, and he's got one company and I got the other, they're paying the same amount of money. The difference is I may be saving $40 on my premium and he's paying $40 more. So when you buy a Medicare supplement, there's 2 things you look for. Go in at the lowest cost premium you qualify for, because it's going to go up every year as you age. And then have your agent, they should have software. We have software. So if Linda comes to me, I can put in her age, I can put in today's date, and I can say, this is going to be your premium today. And my software will show me where she will be in 5 years, because it's a percentage. You have a compounded percentage that increases each year on your Medicare supplement. So if you've got, let's say you're turning 65 and company A's premium is 126 and company B's premium is 156, you're already paying a $30 difference. And then next year that's going to compound at the percentage. And we see averages go from 0.3% all the way to 6.2. So you just have to have, that's why I was like, don't enroll online. Our services, it is illegal for any insurance broker to charge you to advise you on Medicare. Don't try to do this on your own. If you don't want to come to our office, call us. We'll do it electronically. We don't charge a fee for you to come visit with us. And we will help you get the most appropriate healthcare plan for you at the lowest cost for you. So that's what we do. Yes.
Do you cover every single plan, or how do we know what plan?
I'm an agent broker. I have a brokerage house, so I have over 100 and some companies. So if it's a major carrier, I have it.
And you made it comment about Florida versus Illinois.
Yeah, I'm one of my 20 states. I have licenses in over 20 states. If it's someplace warm, I usually have a license there. Because that's where y'all moved.
If we move from Illinois to Florida,
You got to get a new plan.
you're saying that 63 days?
Yes.
And you could do it any time in the year, or you got to do it during that?
No, if you move, let's say you move in March, that's not an enrollment period. You have till May to change. You just call, say I'm moving. That's a special election period. Your hand was up next, then I'll get to you.
So who pays your brokerage fee? Come to the place the policy with?
Yes, so for example, I cannot use insurance carrier names here. So whatever the insurance carrier you enroll with and Medicare give us a flat fee. Yes, this lady in the shirt there.
Are you saying if you move, what if you're, a part-time resident of Illinois and then a part-time resident of Florida in the winter months?
What does your driver's license say?
Illinois.
Then you're an Illinois resident. Yes.
Oh, God, now my train left the station.
We got trains coming and going.
I know. I have friends that are already in it and complaining about increasing rates constantly.
Yes, every year you have a birthday, every year your premium increases. Okay, every Medicare supplement company will increase your premium one time a plan year and near your birthday.
And if you go with one company and you want to switch to another, you have to have a medical evaluation done.
You have to answer some questions on the application. Okay, well, they're health questions. Well, we can get that more into that with you one-on-one. So I'm getting a signal here. Thank you so much for joining me today, being part of this live seminar. As always, I enjoy working with Elderwerks. Our booth is 112 and 114. You could stop by and see me and Andrea, and we can answer some more questions for you if you have them. Thank you again for coming.
So thank you, Mo, from Eldercare.
Okay, thank
We
you.
appreciate you being here.
Thank you.
Please be sure to turn in your evaluations at the